Good morning, everyone. Anna, go ahead and start the recording, please. So, good morning, everyone. This is the MnCHOICES MCO and MCO delegate call-in session for December the 20th. Let's go ahead and get started. So, the folks who are in the call today include Rakia Banya, Sue Kavendru, Deb Maruska, Tina, Tran, myself, and Kathleen Vondram for sure are the ones I know that are here today. So we will be hosting this call for you. So this session is being recorded. You'll use web audio to listen to the session, and you're all muted. Like other calls, we'll have you raise your hand to ask a question, and then we'll call in order that your hand was raised. When we call on you, we'll unmute you. My preference is not questions in the chat. If you put questions in the chat, we may get to them, we may not. It's just good to talk to you and to ask clarifying questions, which is why you hear that preference from us. So our agenda is really small. We really want to make sure you have time for questions. So we're going to go through a few items, and then we're going to let you ask your questions. So let's go ahead and get started. So a few items. So one of the pieces that I am hearing confusion from folks is you might get a message back from the Minnesota Service Hub that says, hey, there's a Maxis role conflict with MnCHOICES. And if you hear that, it's because, and you'll have them, the other part of the message will say, if a person is to have access to MnCHOICES, please submit an access request to modify Maxis access to the INSW role. And the reason for that is Maxis policy doesn't allow a certified assessor to have access to MnCHOICES to create an assessment and access to Maxis for billing. They see that as a conflict of interest. And so the way that that gets rectified or fixed is that the staff will need to get moved to an read-only role for Maxis. And that's what the INSW role is a read-only role. And so for that to happen, your security liaison would submit an Maxis access request for that change, and then they could then include that staff person requesting the Maxis for MnCHOICES. So they could say, hey, we need the Maxis access for this person changed to an INSW row, and then will you please add them for MnCHOICES? So the other piece that is a common occurrence that we are hearing or seeing is a person's certified assessor TrainLink ID hasn't been added to the system. And I just wanted to let you know that when the access ticket is put in, when your security liaison says, is this person a certified assessor? Yes, then the TrainLink ID can get added into the access ticket. So please make sure your liaison knows the staff member is a certified assessor and provide them the TrainLink ID. And then you won't have to submit in a help desk ticket to ask for a people's TrainLink credentials to be added. And then also know that just because a person is in the system with a TrainLink ID for one location, it won't automatically update the other locations. It's not until the TrainLink ID is in that staff member record for that location that data will come over. Yep, and that's what this is about. So TrainLink IDs do not automatically populate because a person exists in another location. You can always submit a help desk ticket if for some reason the TrainLink ID was missed, and then we can add it. So sometimes I get questions about managing roles and permissions, and please know that lead agency security admin and supervisors are able to update and manage roles of staff. So once a staff person has been created, if you're like, oh, they shouldn't have that role anymore, they should have this role, you are able to do it internally. You do not have to put in an access request. And then again, if you go to the Help Center Smart Guide Roles and Permissions, it has all kinds of information in it, including this type of information. So the other piece you need to know is when your staff leave your organization, you're required to remove their access. There are actually minute system requirements for termination and resignation, which are listed here. Termination is you have to remove them from minute systems no later than 1 day after termination, and resignation is 8 days. You can refer to the Smart Guide because you have the ability to unlink the person's account. So you can't activate them, but you can deactivate them. And so the Smart Guide talks about how to do that. The other piece to know is from time to time, we've been hearing, hey, this person hasn't gotten access yet, and we can't figure out why. What we're seeing happen is there are times when a person moves from one delegate agency to another, for example, and what the DHS security team has to do is verify for each location that person used to be employed with or contracted with if that person is indeed left. So let's say I'll pick on Thomas Allen today. I worked for Thomas Allen, and now I moved to Genevieve, and I'm still doing MCO care coordinator work. If no one uh, basically uh, deactivates each of my Thomas Allen records, then DHS security first has to find out for every instance that every contract I have, Prime, West, UCare, Blue Plus, that indeed my employment is um, no, I'm no longer employed by Thomas Allen before they can set up my access for Genevieve. So the more you keep your user employment information updated, the better it will be for people to get access soon enough. So if access is being held up, that's likely what's causing it. So the other question that I have been hearing and up is where are the lists of statuses for forms? Currently, the HRA talks about it in the practice guide finalizing health risk assessment. We have not done this yet, but I have put it in. The next version of the practice guide for the assessment will have it as an appendix, so it will list them all as an appendix. It's coming soon. And then lastly, all of the smart guides for a support plan have the statuses in the changing status of a support plan section. So if you go to the Help Center Smart Guides for support plans, you can see all of the list of statuses for the support plans there. So one of the questions that we've heard a couple of times, and this is one of the pre-submitted questions, and I will show you after I'm done doing these how to pre-submit a question for a call-in session, is when completing an HRA, does there have to be an information in the health insurance tab? And the answer is no. If the user is completing an HRA, the care coordinator can create the HRA when there is no health insurance information available. And then there's been some question about the support plan in Revise. Is there any way to make a revision to the support plan without having to add the missing service dates, services, and rates, since those areas aren't changing? And the way that the current functionality document currently reads is yes, that data does not transfer over and the user must add them. So that's the current guidance. And also just know that this is something that, because it's in the current functionality, we're looking at could there be a fix and when would that occur? The other piece I wanted you to be aware of is a support plan signature sheet was updated. So you can see the date here is 12/20/23 in the Help Center Training Resources list. We updated it to resolve issues with the case manager date field not being long enough. So that issue has been resolved and it will populate as the user expects. So we just wanted you to be aware that that issue indeed has been resolved. And again, you can always tell when something has been added by the start date. It will give you a good indication of when something has been updated in the Help Center. So here's our plan for today. We're going to take first health risk assessment and associated support plan questions first. When there really aren't any more of those, we'll move to the MnCHOICES assessment. with the staying healthy section and any plans associated with it. And then lastly, if you have any other questions, we'll take them. Knowing it's about 9:45, I'll try to manage it by time. I'll split whatever 9:45 to our time is up, and we'll go from there. So Rakia is going to call on you when you raise your hand. So she will call on you. You can ask your questions. I'll have MTZ up in case we need to ask questions from it. So Rakia, I think we're set for questions if people would like to raise their hands.
Okay, it looks like our first question comes from Linnea. Linnea, you are unmuted.
There, can you hear me?
We can.
Hi, thanks for taking my question. My name is Linnea. I'm a SMBC care coordinator at Axis. And I just wanted to go back to a slide a couple back, Teresa. You mentioned that the health insurance information field does not need to be populated in order to start an HRA, but wanted to clarify it does need to be populated by the time we wrap up the HRA because we need that PMAP start date on the assessment as our referral date, correct? So we really can't completely close the HRA until we know the start date of their insurance because that's required on the assessment document.
You're only hearing silence on my end because that is something that I'm sure policy will need to answer.
Okay, all good. I can wait.
Yep.
Yeah, Linnea, and where are you saying that it's required in the assessment for the HRA?
So it's on one of the first screens. There's a field that's called referral date. And
so you're saying you need it for the referral date field.
Yes.
And that date is driven by what's in the health insurance tab?
Right, because the delegates don't necessarily have that date unless we are pulling it out of MnCHOICES. It's not given to us historically from the health plans. So we can certainly start the HRA without it, but we need it before we can finalize and submit the HRA. So just wanted to make sure people were aware of that.
And yeah, I can, while I wait and see if other policy staff have anything more that they want to add, I can confirm that even just if you're talking about functionality, then yes, that referral date is needed prior to closing the assessment form.
Yeah.
Yep, and if you're saying that the date is driven by what's in the health insurance information tab?
Yes. So it doesn't autofill from health insurance. We have to pull it from health insurance and put it in the HRA, but we typically just don't have any other way to know their SMBC start date until that health insurance section populates for us, which can take an overnight refresh or two.
So what I hear you saying is you use the health insurance information field to know what that date is.
Correct. Yep.
So you go, I just brought up MTZ. So what you're saying is you use this date right here.
Correct.
The effective start date.
Yes. And oftentimes if we're building a chart from scratch, if we're adding someone into MnCHOICES for the first time, that health insurance section is not populated yet from Swindex, so it'll take an overnight refresh or two. So our staff have just been finding in those situations they can start the HRA, but they can't ultimately complete it until this is fed over.
Yeah, and what I hear you saying is it doesn't get fed over and actually auto-populate it. You go back here, find it, and then fill it in.
Yep, we manually grab it from here and then transcribe it over into referral date on the HRA. So I guess it's not so much of a question as making sure folks are aware that that's at least how we've been navigating this at Axis. So there can be a bit of a lag there, even though this section isn't required to open the HRA, we do need this in order to complete it.
Rakia, can you hear us now?
We can.
Yep, we can hear you now.
Okay, yeah, I guess you had to unmute us. Yeah, I've been hearing that, that's basically, I think the issue is that the question, I think, was, can we start one without doing,
Yeah.
and so you can, but ultimately, if, because of that date, and there should be a number or a health insurance coming, because everybody who is on managed care has that information. So I think the question we understood it to be is that if it hadn't come over yet, because we're starting an HRA, can we start it? And so the answer is yes, you can start it without that, but it should then be coming over, so if you're gonna finish it, you need to wait for that to show up.
Okay, sounds good. We will just continue down that path and just wanted to make sure that was on your radar. Thank you.
Thank you.
Yes.
Okay, so right now I don't see that any other hands are raised.
So we can move to MnCHOICES assessment and support plan related questions then.
Okay, so it looks like we have Liz. Liz, I am going to unmute your phone.
More SNBC support plan question.
That's fine.
Okay.
You're
on
good.
on the support plan, do you have guidance for when we're monitoring goals? There's a limit of 5,000 characters in the field, and when we come back to goals, oftentimes I need more characters than that. Are we supposed to make a duplicate goal for monitoring? What do you have any guidance on that?
Okay, so I think your question is, you're talking about the character limit. Are you saying that that you have to have a certain number of characters in there for the goal? This would be
no, sorry. In the HRA support plan, I know the goal when we write it out needs to be a certain number of characters long.
Yeah.
But later we come back and write our monitoring and our progress, and that box has a character limit. And on assessments I've done in July, I've already gone over that character limit monitoring the goals. How am I supposed to add that data into the care plan? There's not enough room. Do I make a duplicate goal? Do I do an addendum? Do you have any guidance?
Is it because you're adding additional notes in it from one monitoring to the next, is what I hear you saying, right?
Yes, that's correct. Yes.
So you're using it as a cumulative historical record of monitoring.
Yes, and that's typically been the expectation from the health insurance plans about how the care plans are used. It's a living document. We go back and add goals. Just wondering if you have guidance on this, or if this is the first you're hearing of it and you need to take it back, that's okay too.
Yeah, I'm not sure if I've heard of this one before. So you're saying because you're using it as a living document.
Yeah, exactly.
Teresa, do you happen to have the application open?
I do, and I was trying to decide which one you'd want me to look at. I just brought Charles Ingalls up.
Yeah,
so.
Can you go to the support plan other, the top one that's in progress?
Yep. Happy to.
Yeah, because if the expectation is that if you're using it as a living document, we would need to take that back to our policy staff to determine if we need to update the system to allow for more characters if you're using it as an ongoing document. Can you go to add a goal?
Right here.
Yeah, is that where you're talking about the monitoring progress?
Yes, the monitoring progress box.
And so Can I ask a couple other questions? So how often do you monitor so I can get a sense of like how much historical record are we talking? Thank you.
So it can vary between members. Sometimes it's every 6 months. Sometimes it's every 3 months. It's also anytime there's a hospitalization,
Okay.
a discharge from a hospital, a crisis residence stay, a substance use treatment stay, nursing facility stay. You get the idea.
Yep. Thank you. So I think all we can do at this point, Rakia, right, is take it back. But now we've heard
That's perfect.
basically, you know, the other option that you would have, and that I would recommend that you do so that we can log it, is would you be okay with putting it in as a help desk request form and just specifically say for support plans for HRAs for the add goal monitoring progress field, you would like us to increase the characters to ensure you can monitor,
Yeah.
then we would have a record of it and then we can put it in as a system enhancement.
Sure, no problem.
Thank you.
Thank you.
Okay, the next question comes from Julie. Julie, your line is unmuted.
So far for the revised full MnCHOICES, I've only done those for people who've already been on elderly waiver and their reassessments. I do have a member I'm going to be seeing who had been a refusal. Now he has agreed to a full face-to-face MnCHOICES assessment. My question is, with the support plan in the revised system, I typically open a support plan as I'm opening up the assessment, you know, doing the pre-work. But when I open up the support plan, you have to choose a program. So of course there's elderly waiver and there's other. So when I go see him, I'm obviously not going to know when I go see him if he's going to be eligible for elderly waiver or not. But I typically, in the past, when doing LTCCs, you still do a support plan after you assess them because they might want supplemental benefits. There's things you're planning for and goals. If I choose other after I assess him and before knowing if he's elderly waiver eligible financially, and I work on a support plan with him, I have him sign it, come to find out 2 weeks later he's eligible for elderly waiver, am I supposed to discard that support plan that I've developed under program other? Or is there a way I can just switch it to elderly waiver and not lose what I've put in there? I don't know if that makes sense, but.
Nope, it makes sense.
Yeah, it does make sense, and I'm just going to see if another policy staff can speak to it because I think we specifically created another support plan for this specific scenario. So let's see. I'm going to unmute them so that they can answer your question.
Can you hear us now?
Yes, we can, Kathy. Go ahead.
So a couple things with this. First, I would recommend that if you have a hunch of what the support plan would be, like if you think it's going to be EW, that's the one that I would create to take it offline, is what you're saying, I think. The other thing that you can do is, I guess we have a couple options. So what you're saying is are you saying it's either going to be an HRA support plan or an EW support plan? And
No,
you don't know.
It's a support plan from a MnCHOICES because he agreed to the MnCHOICES.
Oh, okay. Okay. I think in that situation, you're pretty safe taking off the EW, you know, the support plan MCO, right? However, if you, What? Go ahead, I'm sorry.
Well, okay, so I'm just saying if I do that and come to find out he's not going to be on EW, can I just switch the program to other then? Because we have to choose when we're opening a support plan what
Well, I
program it
think you
is.
could choose EW, but then the person gets to choose whether they want to go on. It would show he's eligible, but that doesn't mean you actually put him on EW if he chooses not to take the services.
I
The
don't
assessment is
know
only going
though.
to show his eligibility. It doesn't necessarily indicate that you would do the screening document and put him in MMIS and go through the whole process. And at the
Oh,
end,
maybe I'm not being clear.
No,
And
I
support
me-
plan other is HRA.
no, yeah.
No,
Yeah.
there's an option in a revised MnCHOICES support plan to choose a program of other.
I think what you hear her asking is when you choose a support plan, you choose the program,
Right.
and then the program is selected. And her
Right.
question is, does she have to discard it? Can she edit the program? Could she do revise so everything copies over and change the program? Like what's the best practice?
Unfortunately, once you pick the program, that piece of it, the functionality is such that you cannot change the program that you pick. So I
So
think that answers.
basically what I would need to do, I go assess him. I do an other support plan because he's not going to be on EW yet. You know, again, I don't know if he'll be eligible the date I meet with him, but I need to do a support plan with him. Come to find out 2 weeks later, he's eligible for EW. He wants EW services. Then I have to go back and meet with him to do another support plan.
So we do have a couple things I'd like to do. Rakia, can you go to starting a new support plan since you're sharing?
It's me, Sharon, but I'd be happy to.
Oh gosh, I'm sorry, Teresa.
Can I do it in?
Oh,
you
absolutely.
You have an elderly waiver and a other. Yep. Yep. So what would you like me to do now, Kathy?
Yeah, so go down because she's saying that there's an option to choose other, and I just want to talk about that a little bit. So my understanding is if we choose other here, Rakia, isn't that for HRA? No?
Yeah, yep, it is.
So I just wanted to clarify that with the person that's talking. I'm sorry, I'm not sure who asked the question, but if you choose other here, that other is going to get you the HRA.
So I can't,
support.
yeah, I can't choose that then when I go meet with him.
Correct.
Because he's agreeing
Correct.
to all
So
choices. So that's what's hard here.
Yeah.
We typically do a support plan when we meet with them.
Yeah. Can you hear me?
Yep.
Yeah.
Sorry. Yep.
Oh.
We can hear you.
Oh. Okay.
It's just she was trying to finish her thought, so she's just wondering what to pick. Yep.
So the other thing that we can do is in the help center, there is a blank support plan that was created. Yep. If you want to use that to take notes, you are able to do that. So if you're not comfortable with trying to use the see if the EW support plan is going to be the right support plan for him, you can, in the help center, there was a form that was created that is a blank support plan, but it's just a tool for taking notes, and then you could go back to your office, and once you've determined what support plan he or she needs, then you can use those notes to create the correct support plan.
Okay, and I was planning to do that because I didn't know, I won't obviously know when I meet with him if he's going to go on EW. But so say he's not, I've done the full MnCHOICES the revised full MnCHOICES, not an HRA. He's not eligible, comes out that he's not eligible for EW or doesn't want it. What support plan do I choose? Because I thought if you did a revised MnCHOICES, the full assessment, it's a different support plan than an HRA support plan.
No, they're very similar.
I think she's asking in this list, which does she choose? If he
After
doesn't,
I've done a full assessment, not an
Right.
HRA.
right,
He's
exactly.
agreed to the full. So what support plan would I choose if he does not go on EW? So it wouldn't make sense to do an HRA support plan because he's done a full assessment.
So you're saying he's not gonna go on a waiver at all?
I have no clue. He might not be financially eligible if he has a
Right.
huge waiver obligation, if he doesn't want it.
You can do, the support plan that's attached to EW and things. So once again, I want to stress, you know, there's many people who get assessed for waivers who ultimately aren't eligible. And then you can still do a support plan that doesn't necessarily pull any waiver services.
Yeah. So what you hear Sue saying, and I'm just clarifying this for both policy and the person on the call, is what Sue is saying is choose elderly waiver. If they don't go on the waiver, the support plan won't show those programs.
I'll have to cross it off though physically because it comes across when you print it what program they're on. And if I choose the elderly waiver, it'll
That's
say
only if they're eligible, though. It wouldn't show eligibility for EW if they're not eligible. You're saying the person is not eligible.
I'm just gonna pull up a support plan here.
Would Teresa, could you go scroll up a bit, please?
Yes.
Oh,
so,
I'm sorry, to that, where you were, I'm sorry. And
I was
show,
gonna,
there is,
but what she's saying is that when she prints the support plan, even if eligibility wouldn't be available, it's gonna print, she picked the program EW.
it's gonna show. So for example, I'm looking at one I did last week. On the first page, it says program elderly waiver. She is on the elderly waiver, so it's no problem. But if I pick that for him and he doesn't go on it, it's not accurate.
Yeah, that's what I was gonna try to show. For you, sorry. For some reason, I'm having issues. Yeah, I don't know why I'm having issues with print.
so we have two, we have
Oh, here.
three,
Go to preview.
we have
Okay.
three types. Can you hear me?
Yes.
We have three types of support plan. We have support plan MnCHOICES, we have support plan HRA, and we have support plan MCO MnCHOICES. Those are the
That's
three.
the one I would
types of-
choose because that he is agreeing to the full assessment.
This is what she's talking about right here, Kathy.
Yep.
Mhm.
So, and so what she's saying is even if the eligibility isn't EW because she picked it, it displays. And so,
So
the
are you
question,
saying it would just be, he would just get like CFSS or?
He could, or it might just be supplemental. I have to do a support plan every time I do a MnCHOICES, so, or an HRA. So I'm just questioning what I choose here when I meet with him, not knowing if he's going to be on EW. I feel like this is set up for, you're an assessor, you go assess them, and then, 20
and
days
you do
later,
the support plan later. Yes.
Right, but that's typically not how care coordination works. You do a support
Well, one
plan
thing
when
we
you
have
meet with them.
recommended to people is to pull both the HRA and the EW assessment. And when you start talking with the person, you can get a feel as to, are you gonna be open to waiver services if you're eligible? Would you like to do that assessment? and then do the assessment based on the conversation you have with the person
The health
prior to
plans,
actually doing the assessment.
right, but the health plans direct us to offer that face-to-face full assessment first, and if they agree, that's the one we're supposed to do.
Well, I think if they agree to it, see, I think this is pre-MnCHOICES. I think the problem is that, we didn't have a tool for that. So I think the issue is you have the conversation with the person, be prepared to do the full MnCHOICES. If a person wants services, no. Either CFSS or EW or any kind of services, then you would do the full MnCHOICES. But if the person is saying to you, I don't want those, you're offering them that, they're saying no, then you would do the HRA. Just because a person says, oh, I'm open to the full, because remember with MnCHOICES, we've now extended what the HRA is and the information that's available. So I think when you say the MCO says you have to offer it, it's because in the legacy system that had much more questions. But now we have an HRA that's a pretty robust HRA. So I think you might want to go back to the MCO too, just to clarify that, who's giving that direction. Is that making sense?
But the other piece that I think you hear her asking is if she picks one, right? Picks the support plan,
Yeah.
picks the program EW, and Sue, we hear you saying, right? Like, okay, if she doesn't take EW and the eligibility doesn't show that, you could still use this support plan, that's the MNA MCO support plan, and finish the assessment work. And I think what she's asking about is what does she do? If she discards, can she bundle the support plan copy over to the next one? Should she manually remove program elderly waiver from the printout? I think that's part of what you're
I
hearing
don't know how
her
the system,
ask.
she's gonna have to send that one in, and someone who knows more about the system is gonna have to answer that question.
Yep, because
Am I right? I heard her asking about which one should she use on the front end. And if the person at all is going to be eligible or wanting to access EW, that's the one they should use. If the person says, I'm not gonna take any services, I don't want services, then they should do the HRA one.
Teresa, can I just have you do one more thing for me, please?
Of course, I'd be happy to.
Can you go out to, like, when we were creating the support plan and we were showing the options?
Of course.
And then do you see where, can you go down just a little smidgy farther? And there's CFSS. Can you click on that one? I'm wondering if that's what you're talking about that you need.
Well, it's just.
I think it's about not knowing when she goes out to the visit
Right.
what the program
And
is gonna
I
be.
can start out with the HRA, the MCO HRA. They don't know what services are, you can't just go out and say, well, are you going to want services or not? And then I determine what assessment to do from there. They probably don't know what services they might even be eligible for until you do a full assessment. So
I think the best thing, because I understand what you're asking. And I think we've given a couple options, but I think maybe if you send it in, then we can really spend time, thinking about it and giving you the options that you have. Because I think that would be the best, because I'm kind of confused at what you're asking also,
Right.
and I don't want to make it worse.
Right, and because you had mentioned about, I did an HRA and then he was eligible for EW and wanted that and go back. An HRA would not tell you if a person's eligible for EW. You would have to have done the full MnCHOICES assessment to make that determination.
Right. And so
Right.
if he's agreeing to that, that's the one I'm going to do because
Yep, that's
that's
what
why
I
I'm
would say.
determining. And so
Yep.
that's where my question is, as a care coordinator, we do support planning the same day that we do an assessment. So that's why this is just confusing which one I would choose.
And I
There is
think
a message in the comment section that, let's see if it said something about if the person doesn't, oh, I'm sorry, I lost it. If the person does not want EW, I thought you wouldn't do a support plan if they are not eligible for the waiver. Now, my question, I guess, is that a MCO decision?
No, you would
Yep.
need I think that's her question, is if the person's not eligible, you still need to do a support plan. Everybody on managed
Right.
care needs a support plan. So I don't know, so, yeah.
That's okay. I'll send in my question and
yeah, and then I would also suggest send in the print and highlight that program piece too, just so
okay.
that they have that for reference as well. Thank you
Thank
very
you.
much. Yep.
Well, and then somebody asked the question, demonstrate a full assessment we complete if they wanted to be assessed for services. Yes, if they're not eligible, and then said, are you saying to choose the HRA? If a person doesn't want services and you don't think they're eligible, yes, you would do the HRA. There's no requirement to have to do a full MnCHOICES first and then move to an HRA. I think that's what we're saying, is that we didn't have that real flexibility, or the HRA and the MnCHOICE, the legacy were kind of one and the same. And that's what I was trying to say, is that you have the conversation with the person before starting an assessment. And if a person says, yes, I think I want services, I'll take them, then you should do the full MnCHOICES. Now, they may not be eligible, just because the person says I want services, and that plays out. But if a person says, no, I don't want services, I don't, think I need them, you can do an HRA. You don't have to do, I don't know if that's the question, you aren't obligated
No,
to
it's
do
not my
full
question.
MnCHOICES first and then do an HRA if the person's not eligible.
It's
I don't,
it's more almost about, could program
support plan.
eligibility in
Yeah.
a support plan be editable, is almost what I'm hearing. So that if you pick the wrong one, you wouldn't have to discard your support plan and start over.
We have discussed that. We've heard that when we started. I do think that is in our bucket of things that people have told us that they would like to see. I think that's a huge change to the functionality of the system, so I don't want to lead people astray. I do think that we do have that on our radar. I just don't know, it's not going to happen anytime soon, and I don't know if it would be able to happen at all, but we do have that request on our radar.
and I want to stress, someone says we can't decline to complete a full assessment. No, if a person says they want a full assessment, you're required to do a full assessment. But I did not hear the question saying the person wanted one. I think I heard the question is the person was agreeable to one because they asked, do you want one? But I didn't hear that the question was, so yes, that is correct. If a person says they want to be assessed for EW or for PCA or for services, you are obligated to do that assessment. So I just want to make sure that's not what we were saying here.
So let's go ahead and move to the next question. The person whose name I cannot remember, sorry about that, will submit it in for a help desk ticket and we'll have a larger conversation about it.
Okay, the next question comes from Ashley Lang.
Can you hear me?
We can, Ashley.
Good. I was going back to Liz's question about the goal updates. I had reached out to, we work with 3 health plans and 2 of them require us to update like under the goal based on our meetings. And I had reached out to them to see if we can put the updates under the progress notes in the revised MnCHOICES, because they initially wanted us to write it within the care plan, mostly because they didn't have access to our charting system, but now everyone does have access to the same charting system. And it would also help with the issue of the services not pulling over, like the CL or the RS tool doesn't pull over, you have to retype the whole thing in. And one was iffy and really said only if the RS, if they have customized living, and the other one didn't respond. And I was just wondering if that was an option or what people thought.
Can I restate your question? So what I
Yes.
hear you asking is, in an instance where the change you need to make to a support plan is an edit to goals, that you're looking at putting it in progress notes versus revising a support plan and having to rerun the service, put in the service units and rerunning rates. Is that what I'm hearing you say?
Yes.
Okay, thank you. I will wait and let policy noodle that one over and answer your question.
So Teresa, are you able to summarize that question again?
Sure. So, yep, what I heard the person say, and please correct me if I'm wrong, is when a person's support plan has basically been put in a status that we would consider closed, right? You can't edit it.
Yep. Mm-hmm.
They need to make changes to the goals. To make changes to the goals, they either have to revise a support plan, right, and enter the units and calculate the rate again.
Yep.
They're asking about, can changes to goals be put in progress notes so that they wouldn't have to go through those steps of revising,
It's
right?
not even changes, because if there is a change, we'd update the goals. But if it's just we went out for a visit, this is what they've done to work towards their goal.
Mm.
Why couldn't we just write like the name of the goal and what they've done in the progress notes? Everyone has access to it. The health plans have access to it. Care coordinator, everyone can see it.
And what you've said is that you went to the MCO and asked that question. And are you saying that you've heard different things from different managed care organizations? Is that part of what I heard you say?
Yeah, one of our MCOs lets us print our updates from our PHDoc system, because we chart like a goal header, and then we write what they did to work on that goals. The one of them used to, but then said, no, you have to put it in the care plan, which was fine when it was a Word document and it would be really, really long, but we could do it. And the other one said the same thing. And now we're having issues with all these revisions, multiple care plans, services not pulling over, having to recreate CL tools. If we all have access to the same charting system, why can't we just make a progress note? That's what I'm saying. If there's a goal change, I'll go in and update it, say they don't want to do it anymore, or they change the amount of weight they want to lose, whatever. I'll go in and update that. But if there's no changes and it's just a visit, why couldn't we just write, this is goal A, this is what they've done, goal B, what they've done. And then when it comes to audit, everyone can go in and look at that. It's not like they can't say they don't have access to all the same systems anymore. It's just so much work for us to have to do that every time, revise it. And then it would get rid of the character limit issue. We can write whatever we want in there, like under the title,
Yeah.
you could write visit blah blah blah, and then
Yeah, and
write goal
yep,
ABC.
and I think we understand what's being asked. I just don't know if that's direction that we would give. I mean, the functionality is there for you to do a progress note. If it's just those general notes versus going back to revise the plan, but I think that direction would need to come from the MCO. And I'm going to unmute the line for the policy staff that are in the room to see if they have anything more they want to add.
Hi, this is Kathy. I agree with you, Rakia. This is something, I understand that it's frustrating that you haven't gotten an answer back from one of your MCOs, and that possibly you're not very, you don't necessarily like the other question or the other answers that you've gotten, but this would be a question that needs to be answered by the MCO because it's their procedure policy. The functionality, yeah, the functionality is there to do some of the things that you're talking about in terms of the functionality of the system, but in terms of the policy or procedure that the MCO has, we would have to defer to the MCO policy.
And you had an explanation of what makes sense to you, present that back to them, because, you know, I think MCOs are learning about the system and the capabilities and efficiencies, and so you could maybe suggest that as well.
Yeah, I've tried. A lot of them don't actually do the care plans, and they don't see the side where it takes hours and hours sometimes to update one goal, because now I have to go in and redo the whole service section. It's just frustrating. And not all the health plans are on the same page. They all kind of do their own thing.
Yeah, we hear you, and I've noted it as well, and I think policy has heard it as also. So I can't commit us to having a conversation or anything about it since I'm the facilitator of the call only. So, but we can talk about it after today's call between each other.
This is Amy. Can you guys hear me?
We can.
Oh, so this is Amy, and I just wanted to bring up that we are looking at the about getting the customized living rate tool inputs to pull over. It is something that we have to plan for an enhancement. I know that doesn't really answer your question, but if the answer for the MCOs is no, you have to revise it. It will be easier once we are able to do that in the tool.
So thanks. I think we've gotten down the need, and we can discuss it some more after the call today too. But I think you got direction from what policy is able to give you for today.
Alrighty, thank you.
Yep.
Okay, the next question comes from Kristen. Your line is unmuted.
Good morning. This is Kristen Cygnus from UCare. I just wanted to go back to the individual earlier who was talking about revising the support plan and the character limit. She had said that it's a living document, and I know there was a take back there. So I just wanted to confirm that, yes, that is a health plan expectation that we do use it as a living document. So I just wanted to confirm that. And also, I had my hand up for the same plug that we've already discussed, so maybe we don't need to go into it more, but the support plan, when we're doing revisions, it is dropping so much information when we revise the support plan, more than just the rate tool. We've seen it in the HRA revisions as well, dropping immunization dates, visits for preventative care, goal information. And so when someone's going in to either end a support plan at their annual visit before they create a new one or update a goal, they're having to redo a lot of the support plan to make that happen. And so I just didn't know if that was something that was being worked on or if that's expected and we as health plans need to try to plan maybe a different path around that.
Hi, this is Kathy. Can you hear me?
You can?
Yep.
So some of the things that you mentioned, I believe that we are aware of, the dropping of the dates. I know that Rakia has been working on that. Can I ask a question? Have you sent in a ticket on the things that you have found?
I sent a ticket on one scenario with a specific example, but it's been about 4.5 weeks. They said SME was looking at it, and that one
Okay.
was in particular about it was goal information. So like the start and end date of the goal was missing, and some of the status updates of the goals. So there was 3 or 4 different requirements to close a
Okay.
support plan that got deleted in the process of revising.
Okay. And it wasn't an issue of taking the form offline and online?
No, I don't believe
It was
so.
just when you
No,
were
it was
revising it? Okay.
right. They were just trying to close it out. Member moved to a nursing home and they just wanted to, they were switching to institutional documents.
Yeah. So that's good that you sent that one in. I would encourage you, and everybody on this line, if there's things that you are seeing that are happening like that, if you, first of all, check the current functionality document to make sure that it's not something that, we've currently submitted to our vendor for fixing. But if there are things like that that you are seeing, it's very helpful. In fact, we need that feedback so that we can look at things. But a couple of the things that you mentioned, we are aware of them. I'm not sure I had heard of the goal thing, but yet it is very helpful to us if you're seeing things like that that aren't printing right, or if they aren't appearing when you expect that they should be appearing, please let us know.
Okay. And so is it fair to say then that these are things that are not expected? So we would continue to move towards hoping that they would be fixed at some point, or would we want to try to find workarounds as health plans to avoid that rework?
Well, I can't remember all of the things that you listed off, so I don't want to give you a blanket statement that we're working on all of them, because that I don't want to say something that might not be true. I guess I would really encourage you to, the one about the dates, I know that we are working on that one. If you've already submitted the one about goals, hopefully we will be getting back to you soon. And then if there's additional ones, I would really encourage you to send those in, because when I answer the tickets, I will tell people if it's a known issue, and then, say that we're prioritizing it or what the workaround might be, or direct people to the current functionality document. So the first place you should go if you see something kind of weird or not that you would expect is go to the current functionality document to make sure it's not in there.
Okay. Sounds good. Yeah. And when I initially sent that one in, it was not on the current functionality, but I haven't checked since then. So we'll just keep sending them in as we find new things that are being removed in that process.
Please do that.
Okay.
Yep,
All right.
that's very helpful to us. Yep.
Okay. Sounds
Thank
good.
you.
Thank you.
Okay, the next question is from Alexa.
Alexa, you are off mute.
Can you hear?
We can hear you.
Okay, perfect. Good morning. So my question is about case mix. So the last couple assessments that I've done, when I go to run the eligibility, their case mix shows up as an E, but the behavior field is either a 00 or an 01. When I go back, mess with the assessment, I am able to get that behavior to populate as an 02, which is what it should be when the case mix is an E. However, I just didn't know if you guys were aware that that's happening, because obviously you can't have an E case mix with an 00 or an 01 for behavior.
So the first question I always ask, I'm sorry, this is Kathy, can you hear me?
Yep.
The first question I always ask people when it comes to the assessment, is there's a couple things that we have to do, when you're running results. So you have to run results, and then you also have to go to the screening document and
Correct.
save it
Yes.
before you look at the screening
Yes.
document, and you're saying that was all done.
Yes, correct.
And then you're saying that the case mix is calculating incorrectly, and if that is the case, then we definitely would want you to send that in.
And like I said, so I had submitted a help desk ticket, and then I was able to get that case mix, like that issue to resolve, like when I went back into the assessment, because the case mix, the behavior for these individuals should be an 02. Hence why the case mix is an E. So I was able to go back into the assessment and, kind of look at the behaviors, kind of change things around to get it to be where it's supposed to be. So then my help desk ticket, they responded and said, nope, looks like your case mix is correct, whatever. And they closed my ticket. And then I did an assessment the following week, and it happened again.
So when, for the 02, what was the behavior?
It's like, agitation, anxiety, stuff like that.
Mm-hmm. Okay.
And for
this is an issue. This is an issue that we're working on.
Okay. I just wanted to make
sure.
So
this person has low ADLs?
No, both of them are higher.
Higher ADLs. Okay. Okay. This is one that we are working on.
Okay.
So thank you for saying that again.
Yeah, thank you. Good to know. That is all I have.
Okay, thank you.
Okay, the next question is from Sarah. Sarah, your line is unmuted. Kelly John?
Hi, Sarah, you're unmuted. We hear you.
All right, thank you.
Yep.
I have two questions. One is actually just more feedback on the support plan. When it comes time for someone's annual, I guess this would be feedback on the copying over of information. When someone has their reassessment, do we choose a new assessment, or are we doing a revision? And if it's new, is there a way for old information to get put into, because if we're going to continue services, for example, can we keep that as an ongoing support plan, or somehow have it be able to be populated on the new year's version of the support plan? So I don't know if there's an answer to that, but that would just be optimal.
Before you go on to your second question, this is Kathy. Can you hear me?
Mm-hmm.
Yep.
So when you're doing a reassessment, you would complete a new support plan.
Okay.
So Teresa, I can maybe share my screen. Do you still have that up, Teresa?
Yep, I can bring Charles back up if you want me to. Mm-hmm.
Yes, please.
I still have MTZ up, so hang on.
Okay, thank you. I think I got timed out, so. And what I want to show Teresa is just what we would choose.
Yep.
So,
sorry.
No, you're good.
Oh. Must have spelled them wrong. Oh. I can do Carolyn, right?
Yes, you can do Carolyn too. Yep.
Oh, it's because it's doing it as staff. It keeps defaulting it to staff. Okay, here we go. think this is yours. I saw 2 of them, so.
Yep.
Want me to use this one or the other one?
The other one, it probably doesn't matter. You can use that one because there's less in there. We just want to show starting. Yeah, that might be helpful.
Want me to do
Support.
assessment?
Oh, was she talking about doing the assessment or the support plan for the
Support plan.
Yeah,
But you had to have done a reassessment. You asked if you had to do a new assessment. Yes.
Of
If
course,
it's an
yes.
am-
Yes, of course we do a new assessment. I just didn't know if there was a way to kind of carry over information from the previous support plan to next year's.
Can you
support plan.
show her, if you go support plan there? Teresa, thank you.
Yep.
And then support plan again. Should we just say EW for argument's sake?
Sure.
And then you see where it says reassessment?
Mhm.
That's what you would choose. And then you put the dates in.
Yeah,
and
I
then
think
on the next page, there's the option to say, but I might be getting that confused with the assessment. There might be the option.
I know we can carry over info on the assessment.
I think the question is, will the support plan data copy over from the last year?
Yep.
Yeah, and I'm trying to think.
And I'm wondering if it's in the SMART guide for support plans. Does it
could
answer
be.
it there?
I think, Teresa, if you go to the, don't.
Yeah, go ahead. I'll put it back up.
Oh, no, that's okay.
I just can't do 2 things at once. I can't go look at the help center and do this. That's all.
Yeah, I know.
I'll just pick today's date and let it default the date. Oh, I received other services. But yes, support plan type. Edit.
Okay. So it is, so the reason why you want to do a new support plan is because you want this support plan to pull in the new assessment information.
Mm-hmm.
Does that make sense?
Yeah, that piece makes sense. Just in
Yeah.
the past, we've been used to be able to kind of carry forward info from
Right.
years. So if they have the same agency that does their home care or their PCA or their delivered meals, it's just nice to not have to re-enter that.
Right.
Well, and that's why I was going to go look up see what the SMART guide said, because that's where I would go to say, does data copy over from one support plan to the next? And I don't know the answer off the top of my head, but I'll go look for it while we take other people's questions. And if I find the answer, I will show it to you.
Okay. I had one other question, if it's appropriate to ask at this time. It's about transfers between agencies.
Go for it.
Okay. So I wondered if is there a standard protocol when there are transfers between agencies that are not the same type? So for example, I work for an MCO delegate agency. So when someone is coming from, say, fee for service, they had them in choices from the county, and then they switched over to managed care, and we get the case, but the county has not ended their relationship, nor have they ended their location. We can do the assignment to the new assessor and care coordinator, but we just want to be careful and make sure it's okay to do a new location for our agency, or do we have to is there sort of a courtesy with the county where we need to make sure they know we have the case? Because sometimes they don't know that it's which agency it's been flipped over to. Just wondered if there's sort of a standard that we're all supposed to be following. Was my question communicated?
Usually it means
Okay.
that they're conferring it between each other. So
Okay.
you're okay.
Okay.
Sometimes don't be afraid of the silence. It just means they're talking to each other and then determining who will answer your question. So
I think we've got it
no
down
more.
when like it's an MCO to an MCO delegate, we can easily communicate with the health plan and but just wondering on some of these other ones where it's not the same location type and we need to get going on our work.
Hi, this is Kathy and Sue. So in this situation, are you saying like let's say the county needs to unassign themselves, and that's why you're having to wait?
Well, I guess I think there's an option for us to just add a new location because we can't discharge them, but the
Okay.
only options are transfer and discharge, and transfer doesn't work because they're not the same agency type, and we don't want to discharge them. So I think we just add our location, but I guess we just want to make sure it's okay to add our location. And we're not sure if we're supposed to notify the county, like, hey, we've got the case, you can close it out.
And have you used the transfer instructions that were in the EDOC?
The only transfer instructions that are in there are for those of the same agency type.
Thank you. I just wanted to ask that question. So,
Yep.
Okay.
And so what we've been doing is contacting the county and saying, we have this case now. Are you able to end your, relationship with or end your location? But sometimes it can take up to a week. And I guess we just wanted to make sure it didn't create any technical issues on their county's end.
Right. So what you're saying is that you're assigning the new location and then the staff to the person and moving forward with it, and you've notified them.
Yeah, we actually have
Right?
been waiting to assign our location until we confirm with them. But that we've decided that takes too long. And so we just want to make sure we can go ahead.
Yeah, and I think for system functionality, Teresa, I don't know if you have like the staff assignment, location assignment up for the person that we've been looking at this morning. I think for functionality, it will allow you to add a new staff and location assignment, but I think there might be some downstream impacts on whose names populates on some of the documents because they might still be listed as active.
Right.
So if you go to assignments. So yeah,
it shouldn't have anything, but that's okay.
So,
Yeah. So
I don't know how we can communicate across, all agencies, maybe a more streamlined approach on what to do or,
Well, and I think the other thing you're hearing is what happens if you don't get a
Right.
response at all. Are you allowed to unassign a location and unassign staff is the other piece that kind of comes with this.
Yep. I know it seems like we're able to end the staff member at the other agency. We seem to be able to do that if we don't get a response. We just haven't tinkered with the location too much because we didn't know what would happen.
And so from a functionality standpoint, you could leave the location and it won't have an effect to have it assigned that I'm aware of. But yeah, what I hear you asking is kind of what's the protocol?
Hi, this is Kathy. Can you hear me?
I can.
So I know that this question came up last week in a meeting that we had with users also. And I know that we as DHS need to come up with some official guidance on this. But in the meantime, we do not want it to stop your work. So having said that, we want to encourage you to continue to be able to do your work. And we will work on some official guidance.
Okay, so it sounds like we can go ahead and assign our staff and assign our location and move forward. We'll continue to try to, notify and contact the county. But then we'll await further guidance.
Yeah, we'll provide some further guidance on this as we continue to iron out the details internally. But in the meantime, I think you can go ahead and add your staff and location assignment. But be aware, like on your printed documents, you might want to look those over because you might need to hand correct what name populates in certain areas in your form. So just look for that if it is pulling the old contact.
Okay, we will do that.
Thank you.
Thank you.
Okay, the next question is from Emily. Emily, your line is unmuted.
One is kind of a general question, but it flows into the real question. So we oftentimes hear that, hey, make sure you check the current functionality to see if it's already on there, and that makes total sense. But there's also several things throughout these types of calls in the last few months where I will hear, yeah, that's a known issue. We're going to discuss this. We're going to take it back. Or, yeah, that's a future enhancement. How does it get determined what gets put on current functionality versus future enhancement versus things that just get talked about verbally in these calls?
And I'll take that because I'm the one who updates the current functionality document. So it's actually in my list of things to do for office hours for January. I've created a slide for it. So the answer is this. So if a known issue comes in on your help desk ticket, we confirm it is a known issue. We then write up a ticket for it that says this exists. And then we have a conversation as policy at a meeting that we have. And then from that, then it's determined what happens with that. If it moves forward for conversation at leadership, that will occur. And then from that, then that defect will get put in the, basically, I'll call it the hopper, will get put in the list of items that need to be added to the to the current functionality document. And so usually there might be a lag of a month while that process is happening, but it usually shows up as a new item for the current functionality document the next month. So we try to, as much as possible, have those happening on a regular basis so that you're aware of them. For enhancements, if you have something that you would like to see as a change, we again take them from the help desk ticket, create a ticket for them and put it in the enhancements bucket. And then what we determine is this an enhancement that we need to talk about, right away, like copying rates and dates for support plans, or is it an enhancement for future that can wait? But all of those are logged and sitting in a file for conversation. If your question is, when will we communicate to you what's happening with those enhancements? I don't know that we have determined a process for that yet, but I hear that as one of the things that you're wondering about.
Yeah. And just knowing kind of that workflow of how they go into either enhancements or current functionality does help a little bit. So for example, the question that was spurring this a little bit from my staff were, I know that there have been verbal conversations about how in the OBRA form, in order to select your own name as the person filling out the form, currently you have to scroll rather than being able to type. And I know that we've talked about it, but I don't see it on the current functionality. I just am realizing that I hadn't actually looked at the future enhancements list to see if it's on there, for example. But just trying to determine if that's something that we should keep sending in as a ticket every once in a while if it's not listed on one of the documents, or not, as we've talked about it verbally, that sort of thing.
I know that we're aware of it, and that it's been documented. I would have to reach out to someone and ask a further question about it.
Teresa, and I think this is where it also comes in for the SGG and IG groups to prioritize the fixes, because I know that one is also was also submitted. We did write up a ticket for that one, but I don't know where it's at in the prioritization list amongst all the other items that were submitted as well.
So that's,
and I'm okay if it would not be a priority. I know there's a lot of other things that are really like functional issues and this is more of just an annoyance, it's just not on the document. So then on our end, we're not sure if we should keep talking about it and sending it in because it's not
Right.
documented as something that you guys were aware of. But I know you are, because I know we've talked about it, which is great. But then staff aren't on these calls and don't see it on the document when we tell them to reference, type of thing.
Yep.
Okay.
And I'm going to ask the question specifically, that question about documenting it in the CFD to the policy SME who would be in charge of it, just so that we don't lose that idea.
Perfect. And then similar to, I feel like we've talked about it verbally, but I don't see it written anywhere. Can you tell me the caseload section on my dashboard? That has a limit,
Yep.
correct? It can only hold
20.
25 people. 20. Is that like a hard limit or just you can't scroll through it? Like, for example, if my care coordinators end up with 100 people assigned to them, can they use the search portion of the caseload, or is it truly just going to cap out at 20 and that's it?
It's a good question. We know that it caps out at 20. Can they use the search load to look for more? I don't have the answer to. It's something that you could have them try. But the piece I want you to think about is having them, and we've been having a conversation about this, is should we be pointing people, because caseload tile has a limit of 20, to using the My Caseload and queries instead. And so I'm going to make this a little bit bigger because it's hard to see. So that it's just easier. So where I went is in the access and navigation header up here. I went to queries, and then you can just literally run your caseload, My Caseload. Oh, sorry. Of course, when I'm trying to do it, I can't get it to work, but it normally works. And it will list anyways all of your caseload here. And so you can use it instead of your tiles because it will list everything. Let me see.
And then will you click on the person from that query to go to them?
Yes, you can. Yep, you can go to them from here. So, so you can see some of these. I could take any of these that are on my caseload for my location, but these aren't because I've an administrator. I can see more things. You can click on them and it'll take you directly to them. So you have the ability to do that. Here, I'll do it like this, then you'll see it. Okay, so here's my folks, okay? It's a list of all my folks. I have 23. I can go to any one of them, click on them, and it'll open it up. So you may just find for staff you want to use queries. Yep, and when it goes to queries and it does run query, they don't have to fill the rest of this stuff out. I would recommend not filling it out.
It's just running, right? That makes sense.
And just do run query, and then that way they know they've got the whole list.
Yeah, that's helpful, and it's helpful from an oversight end to see if they have everybody assigned to them yet or not. And then similar to that queries piece, is there a way yet to run a query or some other way to see what is the status of plans? So thinking of the old system from like a case management lens, you could go to my plans, you could look and see whether it's yourself or your agency, what's still open, what's closed, that sort of thing. And I have a strong suspicion that my staff are not moving everything to approved because it makes them nervous. Is there a way to just run that?
So when I go to the query and I do support plan, I can see, whoops, sorry, I didn't mean to do that. Let's go back and do that again. It doesn't have the same functionality as assessment. So you can't see the status of the plan. We are having conversations about that because if you go, I'll just show you the difference. Go to MnCHOICES assessment and assessment type. You can pick, let's see, assessments. You can pick the status and you can see then the plans for that are still open.
Okay. Yeah, not being able to see. I guess I can see the status now if I'm looking at it this way. I'm a little thrown. This isn't just giving like, how do I filter though just from my staff? Because like when I do it right now, it's giving me 7,000 results, which is absolutely not just my team. So is there a way to filter down like just to our
You can do,
location?
yep. So it's got location. So for me, ours look strange because of the way we organize them to test,
Right.
but
That's
you'll be
fair.
able to pick by your location. Yep. And narrow it down.
And can we narrow it down like, and my brain is not remembering, isn't location though like lead agency level? Can we narrow it down further to
So
like the
location,
contracted agency?
right. So location could be, so it could be, I'm going to pick on poor Genevieve again. Genevieve, you care, you know, or something like that. So you can do that. Location is that combination. And even if you're just a county in a county, it'll just, the county list will come up. But if you're a, you know, if you're a delegate, if you're a county who's a delegate to an MCO, then it would be that county and the MCO would show up in the location. So location will get you to that granular level that you're wondering about.
Okay, I'll go ahead and test it out. Thank
Yep,
you.
yep, you're welcome.
Teresa,
Mm-hmm.
this is Kathy again. I just wanted to clarify one thing about a comment that she had just made, or a question she had about the current functionality document. And I just wanted to clarify with her that not every issue that is submitted in a ticket goes on the current functionality document. And so that's why her staff aren't seeing all of their things on the current functionality document. And like Rakia had said, when we write up that it is an issue, it has to be prioritized by those two groups, the SGG and I think it's the IGG group. And so I just wanted to clarify, I'm not sure if that's what she was saying, but I just wanted to make sure that she and her staff know that not every issue that is sent into us gets put on the current functionality document.
Yeah, that makes sense. I guess one maybe follow-up question to that, because certainly not everything that we think should work different will work different. I understand that some things are working as they intended, whether we like it or not, and that's
Right.
fair.
Right.
That's life. If for things that we've talked about verbally and DHS has confirmed, yes, that's definitely something that's not working as intended. In theory, those should all be on the current functionality, or is that a misunderstanding?
Teresa, do you want to speak to that or do you want me to?
I would say that they would be, but Kathy, if you think differently, I would like to hear that as well.
They're not on the current function. If we've said that they're an issue, they could be going through the process. So
Correct.
they have to go through a certain process. And part of that is that SGG group, that IGG group. And there's a little bit more that gets complicated that I don't need to burden you with, but not even if DHS has said to you, thank you for submitting this question. This is a known issue that we are working on. It's not that it will be on the current functionality right away. We have to go through that process before we're able to put it on the current functionality document.
Yeah, and that process taking a while absolutely makes sense. I was just using the OBRA example because that was talked about many months ago. Like I think even like right at launch that was discussed. So that was an example that surprised me. It's not listed on the document because it's been quite some time, and so I'm not sure when it's been a while if we should be resubmitting a ticket or not.
Right, and I think the issue for that one is a good example of its current functionality. You'd like it to function differently, right? So then it becomes an enhancement. And so that's probably why you're not seeing it on the current functionality document. So that's how I'd split that hair.
Okay, thank you.
Yep.
Okay, the next question is from Lynn. Lynn, your line is unmuted.
My question is for a reassessment. So we're case managers and we're doing the support plan after the assessor has completed their assessment. I have several individuals who are unable to complete their support plan because they're unable to put in the COR, but like on mine, I'm able to, but my other case managers aren't. Is this an issue where I need to send in a help desk ticket, or is it an issue with the assessor's documents not transferring over?
So,
Are you working for an MCO? Because there shouldn't be a separate assessor, and maybe that's the problem.
No, so we're contracted through the county. So we're the case
Oh.
managers. So we get the assessment from the assessor, and then we come in, and then we as case managers do the support plan and the case management.
And so
I'm not sure if we have the right people here because this was geared towards managed care work, but maybe somebody can answer that. I don't know.
Teresa, can you restate the question?
Actually, I
I
was gonna ask, will you restate the question just to make sure we understand it again? Thank you.
Yes, so this, when we create a support plan, some of them, the COR is not transferring over. Some people were allowed to put it in, and some there's no function for it at all. So I'm wondering if it's an issue with the assessment that was completed, or if it's an issue where we need to submit a help desk ticket.
And so when you go in and view the assessment, can you see that the COR was chosen?
I mean, we can see the LTC document, and the assessor is with the correct county.
Because you can, as a case manager, can view the assessment.
Correct.
So I'm just wondering if it's an issue of not copying over or a field not. But if that's a required field, it should copy over if it's there, which is what you're asking.
Yes.
And to me, it feels like, and I don't know if policies say otherwise, if we're not in agreement, that this might be one that she wants to submit in, and specifically submit in the person ID and what you're not seeing copy over, just to make sure we don't have a defect. But I'm gonna, in case I'm overstepping, please step in.
This is Kathy. I agree with you, Teresa. I think you gave good advice. I think looking at the assessment to make sure it was included in the assessment. Like Teresa said, you can view the assessment like read only, even as a case manager. Make sure that it was entered in the assessment. I can't remember off the top of my head if that is a required field, but I think you're right, Teresa, that it is. But that would be the first step I would do. But yeah, like Teresa said, if you're expecting something to have been copied over into the support plan and it's not there, that is a situation to submit a ticket with screenshots and also the person's ID. That's really needed. Otherwise, we end up sending an email back to you asking for the person's ID, because then we go into production and actually pull up that record so that we can review what happened.
Right, because what you're saying is bar isn't copying over.
Yes.
And so that's what I would do. I would go look at the assessment and see if it's there. If it's there and it doesn't copy over, submit it in as a defect and put the person's ID in the help desk ticket so that we can look at it. Because you might be seeing an issue that we're not aware of, and the only way we sometimes know is because you guys report them in.
Yeah, absolutely. Thank you. I just wanted to make sure that we had all the information that we needed to give you before we submitted the ticket.
Yep. Nope. I hear you. Thanks.
Yeah, and we've been noticing that, several parts of the support plan are there one day and then the next they're not. So we're screenshotting those and sending those in as well. So I wasn't sure if this was part of the same issue or if it was an assessment issue, but we'll go ahead and put in that ticket. Thank you.
Yeah, you're welcome. I believe that we're far enough along the questions that if you have other questions that aren't necessarily related to the assessment or the support plan associated with MCO M&A assessment, and you want to ask other user access questions or other things like that, that you're welcome to add those questions to items you might ask as well. So just want to give you permission to kind of ask all and any questions that you might have.
Okay, and then the next question comes from Lena. Your line is unmuted.
Oh, hello?
Yep, we can hear you.
Oh, perfect. Okay. And forgive me, I have not looked at the current functionality document this morning quite yet. So if my question's in there, please ignore. But I was wondering, I was working through a CL tool yesterday, and I noticed that my behavior score is not triggering 24-hour customized living. And I'm wondering if that is only triggered by a level 1 behavior and not a level 2, or is a level 2 supposed to trigger and it's just an issue that it's not?
Amy Rumpsa, are you on the call?
I am on the call. So I have to look back. No, because there are level 2s that should qualify you for 24-hour customized living. If it's not triggering, if you want to send that in on a ticket, I need to look at that.
Okay, I'm just not sure if it's supposed to trigger. So that's why, like, I did my whole assessment and I already entered it all in and everything and did all that and just told the facility that she didn't trigger 24-hour, but I don't know if it's a matter of like the times of week they help, if there's a behavioral plan, like, or which options of a level 2 trigger, because she doesn't have any level 1, but she's got level 2. And so I was like, oh, well.
Yeah. What kind of do you mind if I ask what kind of behavior she has?
Yeah, I selected, I have it open here, agitated and verbally aggressive. And then the level of severity is moderate for both.
Okay. Yeah, will you send that in on a ticket? Because that sounds to me like it probably should have triggered 24-hour. So if there's if it doesn't, I'll give you an explanation of why. It sounds to me like it should, but if you could send that in,
sure,
that'd be great.
Do you want the person's information from the actual assessment?
Yeah, if you could send in the person ID number, that way I can look it up, and if they have more than one assessment in the system, which assessment.
Sure. Okay, sounds good. Thank you.
Yep.
And then, Rukia, before we go to another question, I got this question answered. So the question was, when support plan is a reassessment, does the support plan data copy over from the previous year? And the answer is yes.
Okay, and then the next question then comes from Ashley. Ashley, your line is unmuted.
Hi there.
Hi, Ashley.
My question goes back to that querying that we were doing, and I think the functionality with the MnCHOICES assessment helps you drill down to the actual health plan, but we're struggling with just kind of getting through the 4 different levels of completion for just the support plan, and there's not a way to narrow it down to just the health plan, so or whatever the location is. So is there any discussion about adding some of those extra fields so that we don't just pull a list of everyone? Because I'm really hesitant. I don't want to direct my staff to just looking at a giant list of all.
Right, because they're seeing their caseload across all their locations. Is that what you're saying?
Well, if you go to the support plan level.
Yep.
So if I click on support plan.
Yep.
I the program and the status, but I that just gives me like a gigantic list of everyone versus just
Just for your location. Yep. I think,
yeah.
will you do me a favor? Will you submit it
Yeah.
in as a help desk ticket and ask that specific question or state that specific need? State your need.
Okay.
That would be great.
Thank you.
You're welcome.
Okay, then the next question is from Emily. Emily, your line is unmuted.
Hi, I'm back again. This might be user error, so I'm just gonna say it right off the bat. Just doing more digging after we talked a few minutes ago about the queries. I think the issue is that I don't seem to have an option of location when I try to filter. So that's why I can't just look at information for my staff. I see 7,000. Like when I try to, like only per person assignment do we have my location. But when I click the support plan, and there also doesn't seem to be an HRA option to filter just by HRA.
Correct.
To see what might not be moved into approved status. So that's where I'm not sure how to get a good sense of where we're at as an entire agency.
Yep. And again, if I was you, I would put that in as a help desk form. Specifically state what you need to monitor and what you need it to do, because yep, that would be great.
Okay, because when you were showing on your screen, where were you where you had the option to then have a drop down for location?
So yeah, let's go see.
I thought you were able. Okay, yes, that is what I see as well. So let's just add some program.
Yeah, let's see, because you
so
can't
maybe
get.
like just the case.
I think we were looking at in caseload is where you see it.
Just and caseload. Okay, which is still helpful. That's new information, but needing that location option for plans as well. Okay.
Yep, agreed.
Okay, I think.
Because really what you're asking is you're needing to be able to monitor staff caseload, and query currently isn't providing you what you need. And so I think if you can clearly state what you need, then that gives us something to move forward with. Does that right?
Yep.
I don't want to assume.
No, that is nice. I appreciate that. Is it helpful on your end if I compare it to, so from a case management lens, what I currently see in the 1.0 like support plan system and how we can use that function over there? Is that helpful or does that cause confusion?
I think what's more important is understanding what you need to be able to do. How we execute it, I think functionality wise doesn't matter. But I think if you're saying, hey, I want to be able to monitor each of my staffs, all of my staff who with a plan status of this, or all of my staff plans and what their status are. I think that's really what I hear you wanting.
Yeah. Okay, that makes sense. And then one more brief question. Actually, you know what? No, never mind. I'm just gonna be done.
Okay.
I'm gonna save that one for another time. Thanks, guys.
Yep.
Teresa?
Yes.
Before you go off that page, can I ask a question? If you go on, so would plan owner help them?
So if you're talking about support plan, they pick support plan. It doesn't give them plan owner. It gives them.
If you do a query and you do, let's do program, pick a program. Pick whatever you want, yeah.
I'll just do.
And then you pick, you could even pick status of whatever, yeah.
Progress.
And then when you get here, you see those lines to the right with the little, the blue lines up on the right there? And, and you pick plan owner. Does that help them, do you know, because it gives them all the usernames?
Yep.
And then
Thank you, Kathy. It's good to demo functionality and they can play with it. Yep. Because you could see I had some of mine shut off.
If you click on that column of plan owner, on the top, if you click on the words plan owner, in the gray down over to the right a bit.
Right here, this
Right
one.
there. I think it'll sort it by person.
Yep, but there's still, they would have to do that.
Yeah, but at least it
And
gives
then
them the
scroll
plan
down.
owner, and then it would pull all the owners of the plans together, I guess is what I'm trying to say.
Yep.
I don't know if
That's
that would
true.
be helpful or not, but I was just playing with that, so.
Yep, no, thanks, Kathy. I think, again, just playing with the queries and really seeing what they give you and not. And like Kathy said, playing with the, what do you want? So this is what I clicked on, okay? So after I got it to bring it up, then I can pick on it. And I can pick what I want to look at. So active doesn't make sense because it just means that the person's been assigned. So I chose not to do that. But this at least gives you, whoops, sorry, I didn't mean to do that. Go back and do this again, I guess. You can pick the program type. You can pick the status. If you want to look at all statuses, you could pick them all. Run query. It would give you, touch that with a 10-foot pole. Again, you can sort some of the stuff that you don't want to see, and then you can, again, sort up and down each of the columns. You need it in alphabetical order, if you want it by program, by assessment or not. What it doesn't do, though, Kathy, is show them the plan status, except for at the top, so they can't look. Doesn't show them here, the status. It's just giving them a list of all of them.
I think if you pick the status, see by underneath.
Yep.
Then it might give them the status.
Yep, you can put them in alphabetical order again. So again, play with them. Tell us what it isn't giving you that you would expect it to. That's the loveliness of MTZ. You can do the same thing in prod, look at it and see what it allows you to see. We're finally to a place where you're far enough along in using the system, it makes sense to look at this stuff again. So go ahead, Rakia. Are there other questions that we need to address today? We're at 11:20.
Yeah, and currently we do not have any other hands raised.
Okay. I'm going to give everyone a few minutes in case you need to think, or if you have someone else in the room with you and you want to ask them if there are any other questions.
Okay, we have someone, Sarah. Sarah, your line is unmuted.
Hi there. Teresa, you said a few minutes ago that you did find that information could be carried over in the support plan. I'm looking at the help center document and I'm not finding a reference. Are you?
I'm going to put it, I have got it on my list.
Okay.
Because I think the Smart Guide support plan should at least say when the reassessment type is chosen, the support plan data will carry over.
Oh, so it does not currently.
I did a quick scour of it.
Okay.
So I can't say for sure or not, but I have a note on it.
Okay. Thank you.
Yep, you're welcome.
I had one other question. And again, this might be a user error or something we don't know yet, but we had somebody that entered a refusal assessment, and I think it was either on the wrong person or it wasn't supposed to be a refusal, but we got past the point of no return and we couldn't undo it. Is there a way to delete an assessment or somehow note? I think it might have been on the wrong person, but
did you get it to the status of approved in MMIS? Because if not, it isn't to the point of no return. I think it just feels like it. So that's I'm asking that question first.
But that would depend on what type of assessment she completed, because if it's an HRA, they don't have that MMIS
Right, it was a
status.
refusal.
Okay. Okay. Thank you.
So you're saying that the HRA was already marked as complete or done?
Yes, it was marked as complete as a refusal, and I think it was put on the wrong person by it.
Okay.
And we just couldn't figure out how to delete. I think somebody submitted a ticket and they were told there's no way to delete it. And the reason I ask is because this, I mean, we do a lot of reporting to the health plans on the assessments that we do, and this one, you know, will get recorded for someone that's not, I mean, it shouldn't have been. And so we just want to make sure that we are somehow able to flag that or delete it.
Yeah, and the response may have been that we don't, I think lead agencies and even DHS doesn't have the ability to delete a form once it's already in that status of complete, but what we would have to do is notify the help desk at FEI with the vendor because they're able to delete it. So if you have already sent, did you already send it in and get a reply?
I believe so. It wasn't, it was a
Okay.
different staff person that submitted it, but I believe that's what she was told by the help desk.
Yep, and if you submitted it in, then we are internally keeping track of all forms that need to be deleted in those instances if it was created for the wrong person, and then we're submitting them to the vendor kind of in one bulk at the moment.
Okay, so we should just maybe check back in like a month or so and see if they got deleted.
Yeah, you can. Yeah.
Okay. Okay, thank you.
Thanks. Okay, Linnea, I'm going to unmute your line.
Hi there. I just thought of one more question to bring to the group. I'm at a care coordination MCO delegate, and we've had some situations recently where care coordinators are trying to add members into MnCHOICES, but when they are going through that import process, they find a match through the MMIS system, and they're pretty confident the person is the correct person, but either the PMI number or the date of birth from the MMIS result seems to be incorrect. So how I've been advising people to handle this is to use minutes really as the source of truth when it comes to the member's birthday and PMI. So is it appropriate for them to grab that member, to start working on that chart, and to edit the chart in MnCHOICES once it's opened to reflect the accurate PMI and date of birth as shown in minutes instead of what's loaded into MnCHOICES?
So the issue is you can't edit PMIs.
Okay. So once someone has a PMI in MnCHOICES, that's not a field that can be changed.
And so the question is usually PMIs, if you have a PMI that's in there and then you have another PMI that is the correct PMI, it usually requires a PMI merger, which is a separate process outside of MnCHOICES. But I think your bigger question is, what do you do with a person?
Right.
Do you create a new person or not?
Correct.
Or, and I'm not ready to answer that question today.
Okay.
But I think it's something that we could take back and make sure we give an answer that is more correct and more articulate than my trying to figure out what to tell you today.
Okay. What about date of birth? If we notice a discrepancy in birthday, if it's off by a date or there seems to be a typo in the year, is it okay to edit that one to match what we see in minutes?
So when it's coming over to MnCHOICES, it's coming over incorrectly, but you can verify that it is the correct person.
Right, right.
I believe birth date is an editable date, but policy, I can't speak to the policy side of it, so I can only speak to functionality. And you're only hearing silence because, again, they're possibly talking to each other, so I just want to give them a moment.
Yeah.
Hi, Teresa. This is Kathy. I think we need to have that. If she could please send in an example, that would be great so that we could look at it.
Okay, I can do that. I'll check with some colleagues and grab some of those examples. All right.
Thank you.
Thank you all.
We are 2 minutes to, and I'm thinking we probably can't get to another question.
And currently I don't have anyone in the queue.
Yep. So I'm gonna take a moment and sorry. I go to partner link and I'm gonna show you this. So if you would like a question to be addressed at the next MCO technical meeting, which is 2 months away, you're welcome to put in it through the pre-submitted questions. And I was gonna get to that. Okay, so you could submit it in, whoops, here. So I'm on the MnCHOICES revision project page, and you can click on this, submit your launch webinar questions, and we're using it for pre-submission questions for call-in session. And if there's an office hours that's sooner, sometimes we're adding them to the office hours calls. So I pull them about 2 weeks before an office hours. So I've pulled them for January, but you're welcome to submit them and then in between as well. If you have a question you want everyone to hear the answer to, then that's what I would recommend. If you have a question that you need answered and doesn't need to wait, please don't put it here. Please instead put it in through the help desk form. But I just wanted you to be aware of it. So with that, let's go ahead and close the call. So thank you everyone for coming today. It is very much appreciated. Please know that the Disability Archive webinar page has both the PDFs and the recordings. So if you want to go back and listen to any part of today's conversation, you can. And so with that, I will, I'm going to show you back. This is where you can go to pick MnCHOICES and you can look at the PDF and the recording. So with that, I'd like to say thank you, and we will see you in another couple of months. So thanks very much and have a good day. I'm going to go off the call, folks. So